Morning, Joint Base Charleston. I'm Command Master Chief John Lonsdale. Happy to be here to talk with you about this COVID-19 issue we have going on.
I'm Dr. Peter Baldwin. I'm the Joint Base Charleston Public Health Emergency Officer.
I'm Sergeant Major Malls from the 841st Transportation Battalion.
And I'm Lieutenant Colonel Houseborn Whitfield, the commander of the 841st Transportation Battalion.
And good afternoon, I'm Colonel Terrence Adams, commander of Joint Base Charleston. So today we were here again to have another conversation about where we are in our status. Many of you all know that on yesterday I declared a public health emergency for Joint Base Charleston, and simultaneously we were able to bring down the base to a mission critical status only. And what does that mean? It varies per unit of what is determined to be mission critical. And we're working with all of the commanders across the Joint Base to make that determination. I know we've gotten a lot of questions about why is my spouse still coming to work. As you all know, when I talked about this yesterday, we're still following DoD priorities. One of those priorities is to ensure that we are ready, right? We want to make sure that we are ready, and our nation is requiring us to be ready. But first, we talk about protecting the people. So those DoD priorities were protecting the people, maintaining our readiness, and the third one was the whole of government effort that we have to support. On that second one, maintaining readiness, that's going to hit across the board. If you're watching the news, you can see that the president ordered the Comfort and Mercy to go out and go underway to try to support COVID-19 in different areas of our nation. In order to do that, those sailors have to maintain their readiness to be able to respond. At some point in time, if the nation asks us to move mobile hospitals around, our military needs to remain ready to be able to do those missions. So in order to do that, that takes a lot of support. So some of the spouses will still have to come in to work because we are the military and we have to maintain our readiness status. Another question we often get, if I've been seeing on Facebook, is why are some of our schools still in session? So across DoD, all the different services, Army, Navy, Air Force, Marine, they continue to maintain their pipeline for students. And some people ask why. The why is that it takes a lot of work to be able to build a nuclear sailor, for example, or an aircraft pilot. That means that if we stop that flow, that could be a detriment that we would see for a number of years to come. So we're going to try to ensure that we keep our people safe that come on to Joint Base Charleston at the same time that we maintain readiness. So those are some of the larger reasons. I got other questions about our CDC facility. In order to have our soldiers and sailors and Army Marines who come on Joint Base Charleston to work, child care is a vital part of that mission. We want to make sure that child care is available, but at the same time we do understand from our workers' perspective, the providers who work in our child care facilities, we want to make sure that they are safe as well. So we're looking at how can we minimize the capacity inside there. We want to reduce the number of kids coming to our CDC. We've talked to the mission commanders since the last time I spoke to you all, and we're working some options to make that happen, to reduce our footprint there. And that's going to require some different changes in the household to be able to make that happen. We're looking at a lot of different things to handle some of the questions that you all have been asking. So this time what I want to do is turn to our doctor here. He's going to give you a quick update on where we are with our status. So over to you, Pete.
Yes, sir, thank you. So we do remain in HP Con Bravo, and that means that we're taking precautions to try and mitigate the spread of this COVID-19 situation. Currently, the state of South Carolina is reporting 60 cases of COVID-19, including one death. And those numbers may be changing as I'm speaking right now. I know the governor of South Carolina is going to be giving a press conference that will likely update those numbers today. Locally, Charleston County is reporting 4 cases. Berkeley County is not reporting any cases, nor is Dorchester County, though all of those counties have moved to some emergency status. And you guys have noticed that. Bars and restaurants are closed, carry-out only, schools are closed. All of this is to deal with the situation. You've also heard that we do have a positive case amongst our Joint Base Charleston population. That member tested positive. We took every precaution to make sure that their family was safeguarded and sequestered away from the population, that member was safeguarded and sequestered away from the population, and any close contacts of that member have been put on quarantine and are not mixed in with the general population. We have done everything we can to coordinate with medical care providers in the local area, the state of South Carolina Department of Health and Environmental Control, and the DoD to report that we have experienced COVID-19 in our joint base population. What does that mean for all of you? Well, what it means is that all of you need to continue to doing what we've been asking you to do. Strict hand hygiene, cleaning your house often with some sanitizing wipes, or good old soap and water. The other thing that we need you to do, that we are taking precautions for, you'll notice that this setup that we have for this town hall is a little bit different than most. We need to have you strictly social distance. Our crews, our air crews, our schools, our nukes, our sailors and airmen are taking those precautions, and we're asking all of you to do the same at home. We need to safeguard our national security, and part of that is social distancing. So please take that to heart. Thank you, sir.
Thank you, Pete. So one thing to remember is that as we practice social distancing, what we really want is physical distancing, right? We want you all to be not in close proximity of each other. But we want you to stay in touch. One of the most important things during this time is that we don't have our spouses or the military members alone in some situation. So we want to make sure that supervisors are still checking in with their members, first sergeants are checking in with their members to provide them any kind of support and care that they may need. We know the questions that you have been asking out there, and we're working diligently to continue to answer those questions. We're refining our processes to where we can get answers back to these questions as soon as possible. And what we want to do right now is just go and we have a member here who's ready to answer plenty of questions that we have out there. So start with Will. You can give us our first question.
Yes, sir. So the first question was asked earlier in the day by Christian, and he was asking what process and protocols we are using in implementing COVID testing. And I think this is probably a question best answered by Lieutenant Colonel Baldwin.
Thank you. So our COVID testing, the practices and protocols that we're using are the same as the state of South Carolina. If you feel that you're symptomatic or that you need COVID testing, we'll engage with you. We're asking you to contact either the 628th Medical Group, the Naval Health Clinic Charleston, or if you're not a beneficiary there, one of the local health agencies here. You can also contact South Carolina DHEC. So those local health agencies, MUSC, Medical University of South Carolina, has a virtual site, musc.care. Governor McMaster has been very clear that is one of our best options to be screened for coronavirus testing. Trident Healthcare has the ability to test, and Roper St. Francis Healthcare has the ability to test. And so those are our options for our folks. And those are the protocols we would like you to follow.
All right, thank you, Lieutenant Colonel Baldwin. The next question, sir, surrounds yesterday. I think there was a posture that was implemented by the Joint Base for mission critical. And there's some questions as to what that really means.
Okay, so mission critical means that we want to make sure we have enough people that can execute the mission at the level that's above mission essential. Since this is kind of new for us, we have never been in a posture where we needed to come up with new terms. Usually the base will go down to mission essential, and we usually do that when we have hurricanes. If you've been around here for a while, you know that we've evacuated the base for the last 4 years. So it's easy to say mission essential, but when we started using that terminology, it was taking away too much of the capacity, because usually on mission essential, everybody leaves the installation. So we had to create another term, and we use a mission critical to be able to increase the number of people that would need to remain on the base to ensure those no-fail missions take place. Again, I have some missions here that have to go. I know the 841st sitting with us today, they're still bringing back ships. So we have our flying units that still have to fly. If you can imagine the things that we're doing across the board in the CENTCOM AOR and AFRICOM AOR, those missions still have to happen. So we bring food to some of those areas there. So all the things that we do as the United States military will continue to take place. So in order to do that, there will be some airman, a soldier, a sailor, or some Marine or Coast Guardsman who's going to be the person behind that. So we want the family unit to have an appreciation during this time. The military member will still be working. It is different than we say that maybe in the civilian life, where people can close down their businesses and shops. And some of those folks are in financial need because it's changing their way of life. But as a military member, we go by a different creed and different oath. And I would hope that the families out there would appreciate what we do and support our military member. At the same time, we understand there is a lot of fear that's going on. But as a military member, we're going to still have to perform our mission each and every day.
So I'd like to add too.
Sure.
I think one thing to keep in mind is that mission critical is going to look different based on the command that you're at. So we have one of the beauties of Charleston, of Joint Base Charleston, is all the different missions that we have. So each mission partner is going to have a different criteria for who they consider mission critical. So just keep that in mind.
Great point, CMC.
So Rachel's asked a question as to why we aren't putting emergency measures similar to our hurricanes in place in this circumstance.
Emergency measures like,
Not really elaborated on, but
So we are taking precautions, right, as far as what we're doing. It may not be, but I guess the simple answer would be it's a different type of emergency.
And we can't travel.
Right.
We can't.
So this is totally, the entire situation is different. In the hurricane emergency, we would evacuate everybody, off the installation. It's totally different. We do that temporarily because we know the hurricane is going to pass and it's going to be in short duration. What we're dealing right now with COVID-19 is not expected to be in short duration. So our response and our measures are going to be totally different. But thank you, Rachel, for that question.
okay, so the next question is about individuals who may be at home with folks who have compromised immune system or underlying health issues, and what precautions should be considered for those individuals to keep them safe?
Paul, you want to take that one?
Yes, sir, I can. Thank you. So, so this question has come up a lot, and it's a simple answer, and that's again social distancing. So, if you have that immunocompromised member of your house, and you think you may have been exposed, please stay away from them. Use a separate bathroom. Sleep in a separate space if you have that opportunity. Clean often, and wash your hands, and make sure that you are staying away from that immunocompromised person in your house, if at all feasible.
Okay,
Thanks, Doctor. Appreciate it.
sir, the next question I have is from Anne Marie. She's asking if we're looking to make any changes to who we're providing care for in our CDCs in the coming days.
We are, but what we want to do before I go to any kind of draconian measures is we're trying to ask the members' leadership to be able to assess who really needs to be in the CDC. If there's another plan that they can do, that would be great. I know the Air Force is working on trying to get ways to reimburse the families who've already paid, I guess, prepaid for their child care to get some reimbursement back. And I do know that process is underway. But we're trying to get the folks to voluntarily reduce the amount of kids that are going to our child care. And I think we're going to get there. In the conversations I had, an hour ago with the mission partners, I do believe we're going to be able to get there.
Sir, we've had a couple people ask about drive-through testing for COVID, if that might be something that might be implemented here, either in the Low Country or specifically here on Joint Base Charleston.
Sir, I can take that question. Yes, sir. So drive-through testing is happening in Charleston. MUSC, I know, has something set up. Now, to get that drive-through testing, you have to engage with MUSC through their portal or in some way be directed to that with an appointment. You cannot just drive down to that test site and go get that done. In the coming days, as testing capability becomes more available, we may entertain those options here on the Joint Base at either NHCC or the 628th Medical Group, but we are not postured to do that yet at this time.
So this is kind of a follow-on to that question. So there was a question whether TRICARE Prime, retirees specifically, could potentially use MUSC's telehealth to get screened. Apparently they have a drive-through capability that they've established.
Yes, they do. So our TRICARE beneficiaries, our TRICARE Prime beneficiaries, the MUSC Care portal is a free service. You have to use the promotion code COVID-19, But the other thing that we ask you to do as well is call the nurse advice line that we have established at both NHCC and at the 628th Medical Group, so that we know and can be aware as well as your primary healthcare providers that you do have some questions and concerns, so that we can guide you through that process along with MUSC.
So the next question is from Kristen, who asks if the commissary and the shopette will remain open.
Yes, at this time, there's no change as far as them being open. They are looking at their hours of operations as far as to ensure that they're trying to manage their employees just like everybody else is. So I know they've adjusted some of the hours that are there, but right now there's no plan that I know about that would close down the commissaries. You have to imagine this, right? We've kind of put you in a difficult position to where we're trying to restrict movement. You're not able to go out and sit down and have a meal now in the low country. So, our ability to take away food options or the groceries is something that I'm not looking at doing at all, because that doesn't make sense. So we want to keep, your ability to go out and buy food to take care of your family, feed your family. It's not something that we're looking at doing right now at all.
And they recently limited the access. Also it's only ID holders, CAT card holders, and DOD ID holders.
Great point, CDC.
So Christian asked how many COVID tests have been performed on the installation for members on the installation.
So COVID tests on the installation are 15 that we are tracking and following along with South Carolina DHEC. Of those 15 tests, we do have the one positive. 7 of those tests have been negative, and we're waiting results on 7 more.
Okay.
Sir, we've had folks ask questions about various services on base and whether they'll be open or not, and where they can find that information.
Yeah, so we have created a great chart that's out there. It's on our Facebook page as well, and we also have it on the base webpage. It's kind of a colored chart between red, green, and yellow, and it lists the services and it tells you the color or the condition of the services. So anything that would be red will be closed. If it's yellow, it may have a note there meaning reduced services, and if it's green, it's like normal operations. And we're gonna try to make sure that's continued to be publicly available, and if we have to change the conditions or the category, then we'll repost that with an updated slide.
Sir, we had a question about how an area should be cleaned or disinfected should an individual test positive for COVID, and how, if they've been in that space, how it should be handled.
Right now.
So if a person's been in that space, really there's no sort of special sanitization methods that you need to do. Again, though, you need to take care of that area. Wipe it down with approved cleansers. The CDC has great lists. The EPA has great lists of those cleansers that'll work. A lot of them start with the words Clorox, but not to advertise something. Check those lists to make sure that that's what you have. There are also some simple home bleach solutions that you can use, and then soap and water as well. If it's a heavily used area, there are some recommendations that indicate you might want to think about cleaning those things as often as every 4 hours.
So I would ask that each one of you all learn a little bit more about the virus, how the virus spreads, and I think having that additional education will be very helpful to change your behaviors that you're doing right now. There's a video out there called COVID-19 Basics. It was developed by an Air Force doc that's up in Alaska. Very well done. Kind of gives you the one-on-ones about what COVID-19 is, how it spread, to give you that detail. So I would urge everybody, if you have not watched that video, we have it on our page. We'll pin it to this live Facebook session when we put it out there for you all to rewatch it. But that is an excellent source to try to give you an understanding of the virus and also the things that we're trying to do right now to stop it. You have to kind of understand how the virus moves and spreads in order for you to change your behavior. That's why social distancing is important, washing your hand, all the basic things you've been hearing over the last few weeks, why they are so important. You need to understand the virus and how it works. So please, I urge you to watch that video.
Sir, we've been asked if there will be any changes to installation access.
So right now we're looking at making some changes. I would not want people who don't need to be on the installation to be on the installation during this public health emergency. We made some decisions earlier in my crisis action team that we have a program that's called Trusted Traveler. Many of you don't know what that program is or means, but right now as you drive onto the installation, we check only the driver's ID. And Trusted Traveler is a program that gives the ability to trust the person that's driving the car, and only one person has to show their ID. I made a decision earlier to move that, so on tomorrow morning at 0600, I've suspended Trusted Traveler. What that means is that all members in the vehicle must now show their ID. You may find later on the following week that we then will change that condition to where only authorized members need to be on. And so what does authorized mean? We're going to work through the weekend to be able to determine that and put that out there. But in short, I do not want to continue to have people on the installation that don't have a firm reason to be on the installation. And that is all in the same steps of how we're going to minimize travelers, minimize movement, and also not having the people on the base that don't need to be on the base. So that's a different posture. That means maybe if you had a friend that may have been coming over for convenience, that we're going to take away some of those options, because this is not the time to have convenient people that's coming on the base, because it can continue to increase the traffic on the base. As we move down from a critical mission manning, we're also going to try to ensure that we're not having random people coming onto installation that don't have a reason to be on the installation.
Sir, I've got a question from Shanna. Her husband will be separating sometime in April, and she just is concerned, would like to know if he'll have access to resources as he prepares to separate.
Yes, so where we have a lot of our workers that are in a minimum man kind of posture, using telework, we're going to do our best to try to keep certain functions going. Right? So if people have to PCS, I think recently comes out that if your PCS is approved, then the military is going to go ahead and allow you to retire that day, which means that we have to do certain paperwork to ensure that that happens. So we will allow that to happen. I will ask your patience as we determine what type of manpower we need to come in a telework environment. That things may be done a little slower because we're trying to figure all the things out. But yes, the base will continue to process those retirements which have been approved, and also separation.
So, sir, Nikki asked if classrooms and work centers are being disinfected on a daily basis.
Classroom, I guess it depends on which classroom across the installation. What we have put out in our directive is to ensure that people are disinfecting, wiping down door handles, knobs. In some areas we ask folks to keep their doors open so they don't have to touch the doorknob. We want to make sure that everybody are following the rules that we put out earlier, as far as making sure that you are constantly doing that. Especially if you're in a high traffic area, you have a lot of people moving around. Maybe you should do that, more frequently than you would in a low traffic area. But we're allowing those building managers and those mission commanders to make that call to ensure that they are sanitizing their areas.
So Jessica has asked if we have implemented staggered work schedules.
So Jessica, in certain office areas, I think they have. I was briefed yesterday that some of the work centers have. They call it port and starboard. That they will be implementing those work schedules. Well,
that's very good.
Thank you. You're welcome. You're welcome. I'm learning Navy in this job. I've had an opportunity to learn Navy, and I do know that they're doing that. So, but each one of these answers are really a mission commander and mission specific. So I can't speak across what all of Joint Base Charleston is doing, but I do know some units have implemented that. A lot of them are doing telework, right? We're finding ways to ensure that we keep members in the right duty status, whether they're a civilian or a military member. So a lot of work is going on. Again, since this is kind of unprecedented territory that we've been in, a lot of people we're trying to learn as we're doing this. A lot of policies have changed and given us authority that we didn't have. And now before, if you were teleworking, we had a number of different steps. Now we're making telework easier for people to get on board with teleworking. So we're trying to remove any barriers we can to ensure that we don't put people in danger by having so many people on the base. Thank you.
So we have a question from Jared, who asks how the current situation is going to impact things like ALS, promotion ceremonies, and other events like that.
So great question, Jared. There will be an impact. We are not going to look to put people in any kind of additional danger if we don't have to. And now all this is depending on how long we determine that we're going to be in this posture. And no one knows that answer definitely today. But for ALS, we suspended the current class that we had in ALS. So those groups of people will come back at a certain point in time to finish, and then they will graduate. Again, for ceremonies, I would like for ceremonies to still happen, but we want to make sure that we're following the social distancing. And as you understand, the president came out saying let's not have no more than 10 people. We want to do those things, but it's going to have to take all of us working together to ensure that we can make some of those things take place. We want to be able to keep things going so it doesn't get built up over time, but at the same time, we want to make sure that we're protecting our people and keeping them safe.
On the Navy side, make sure you're paying attention to the NAV admins. The selection boards were postponed for the senior enlisted, so that's going to have a tremendous effect on senior enlisted advancements. With that, the letter to the board packages will be due at the same date as they were previously. And then the E4 exam was recently canceled, so there's definitely a Navy impact also.
Same for the Army, sir. There's been delays in upcoming boards. But I will tell you, when it comes to awards and promotion, this is where our leaders, our senior leaders, have given us the creative rights to make this make sense. And so again, with our goal of protection, understand that there are ways that we will, at our own discretion, try to continue some of our normal military traditions. But there are some things that are going to be impacted that are DOD level that we here cannot impact. And so as you continue to communicate with your leaders, read the posts, get on Facebook, and making sure that what your service-specific changes are will help you to better inform your soldiers and even your families.
Thank you, Colonel Phil.
Sir, I think we're down to our last couple questions here.
Okay.
The next one's from Casey, who asked about how the current situation is going to impact the air show that we had planned in April.
Casey, great question. So on Monday, I officially canceled our air show, our air expo that we had scheduled for April. We've contacted our vendors at this point and let them know. I sent out a press release out to the news outlets to put that information out there, and we've notified the community as well. So we will not have an air show here on Joint Base Charleston in 2020, and we're all saddened by that, but there was no way that in this current environment that I would want to bring that number of people together at this time. So we will be planning our next air show at some point in time, but we don't have a date. But thank you for that question.
So a question from Henry, who asks if the 628th Air Base Wing specifically will be going to a minimum manning posture.
So Henry, we're not at minimum manning. As I explained it, and I'll be meeting with my leadership in the 628th Air Base Wing, we will be mission critical. And that means that we have to determine what our mission partners need and come up with creative ways to do that. So that may mean for some offices that they can continue to perform their duties by being at home, and we would do it in that capacity. For say our defenders can't do their job at home. They need to be on the gate, and they're going to continue their regular schedule. So we're looking at each one of our different areas to find out how can we put less people at risk by having them come to the installation, but at the same time supporting the missions. So as our mission commanders on the base, since my wing is the wing that supports them, I have to keep the base open. We have to do certain functions, and we need people to be able to do that. So there's going to be some units that have some flexibility to power down really to what some people may know as minimum manning, and there's some offices that cannot. So we have to be in the 628 responsible for the upkeep of the base, for taking care of the things that we need to do, and that's my goal. And my goal next is to communicate that directly to my wing and have a conversation and field any kind of questions they may have about our posture. I'll be starting that on tomorrow, starting with the leadership, and we'll find other ways to continue to communicate with the broader wing of 628. But thank you for that question. Now I think that was the last question we're going to take. I talked to my team today about how can we be in a posture of continuing to answer questions. We're going to produce a process upon which people can type in some questions, and we'll have people there to try to answer those questions. We haven't solidified how that's going to take place right now, but that's my next step. We don't have to just wait until a Facebook Live session for you all to answer questions. But I'll turn it to you, CMC, do you have any closing remarks?
I'll just say that this is unprecedented situation that we're trying to deal with here. And I just want you to know that your leadership is working round the clock to try to figure out how best to juggle, because our number one priority is the safety of our sailors, airmen, and soldiers. How do we juggle that with the mission requirements that we have? So I just want you to know that we're doing everything we can.
Thanks, CMC. Dr. Baldwin, anything?
So the biggest things that, I'm going to sound like a broken record. Wash your hands, social distancing, and if you're sick, stay home.
How's your mate?
Just everybody take heed to what has been put out and continue to try to be safe.
So I just want to say, first of all, thank you all for inviting and making the joint base message the same across the services, and would like to echo the sentiment from everyone here. But also want to add, just be patient with the process. We have not done anything like this in the history of our nation. So as we are thinking through it, please help us with some great creative solutions so we can continue to lead and be out front for our nation's strategic objectives. Thank you.
While we know many of you are fearful of what's going to take place next, what's going to be the next shoe that drops and the next change we're going to make at the base. I asked many of you if you can find the things that are in your life that may be different, and some of those things could be better. This is an opportunity to connect closer with your family. If you have an opportunity to telework at home, you may find an opportunity to do some of the things that you weren't able to do before. We ask you to look for that silver lining. I took a question maybe about 2 weeks ago about somebody asked me, am I optimist or pessimist? Do I see the glass half empty or half full? And my response is that I was just happy to have a glass. You have an opportunity to look at this tragic thing that we're going through right now, this crisis of COVID-19, and to change your perspective of how you respond to it. We're trying to do that and try to find innovative solutions to keep you safe and at the same time push out the mission. That's my job here as the installation commander, and that's what we're trying to do. Again, please be patient, follow what the doctor said, continue to learn more about the virus, because I think that's an important part of this. We appreciate what you all are doing. I know many of you all have very caring hearts for us. Nobody asked what the questions we have, but our airman that was hospitalized is doing much better. The airman's family, I talked to the spouse today, and she's in great spirits. And additionally, we hope that airman is going to be released today or tomorrow. So there are good things that are going on surrounding this tragic event, and we hope that you all will stay connected with us. Again, remember to stay connected on our Facebook page and then also on our web page, and we're going to try to stay in contact with you. Thank you all. Have a great day.